After weight loss surgery, patients can regain their weight back. The majority of our patients, probably 85% of our patients, lose the weight and then maintain the weight except for a little bit of weight gain each year, which is normal. With a gastric bypass, we expect you to lose 75% of your excess body weight and level off somewhere about 60% for the rest of your life. With a sleeve, it's a little less, 65% weight loss initially, and then somewhere around 50 to 55% lifelong, we hope. After bariatric surgery, patients can gain back some weight, or in some cases, they may even gain back all their weight. One of the things we want to avoid here at Advanced Surgical Partners is patients gaining back all their weight. That's one of the reasons we see you a lot, and we want to see you for the rest of your life. We see you at 2 weeks after your surgery, 4 weeks, 6 weeks, a month after that, 3 months after that, at 6 months, and then yearly for the rest of your life. The reason we want to see you yearly is we want to check your blood work, because one of the most important things after weight loss surgery is taking your vitamins. And that's so you don't develop deficiencies that can cause problems with eyesight, hair falling out, liver function, kidney function, and things like that. So it's very important you get your blood work checked at least once a year for whatever type of weight loss surgery you have. The other thing is, things happen in life. Something's going to happen that's going to stress a patient out, and their eating habits are going to change. The new lifestyle they've developed will go haywire for a little bit, and all of a sudden they'll start gaining some weight back. Often patients will come back after they've gained the weight and they'll say, I was embarrassed to come back and see you. And we don't care about that. What we care about is, as soon as you start to see that weight come back, a 10-pound or a 15-pound weight gain, come back and see us. It's much easier to help the patient at that point than it is after they've gained back 100 pounds or something like that and may need to consider having another surgery. So it's very important. We consider patients part of the family. We want to see you at least once a year. And the good news is we're here to help. And the best thing to do is, if the weight starts coming back, get in to see us as soon as possible. Our dietitian will work with you to get back on track. Our nurse practitioner has a whole group of medications he can use to help decrease the appetite, decrease the cravings, and help the patient get back on track. And we can also look at the tool, the sleeve or the bypass, and see if something mechanically has changed with it, and if there's something we can do surgically to help the patient get back on track. And we are one of the only practices in the state of Virginia that will revise cases. And what do I mean by that? So back when patients had a gastric bypass 20, 30 years ago, again, we didn't teach them how to use the tool. So they did overeat, they did stretch things. And Dr. Bregman and I have ways of going back in laparoscopically, even if they've had an open surgery, and resizing that gastric bypass, making the pouch smaller again by stapling it, and even making the opening between the stomach and the small bowel small again. And there are also endoscopic techniques that are new coming out that we can do endoscopically, where the patient can come in, have everything downsized endoscopically by going down through the mouth into the stomach and suturing that way, and go home the same day and not even have to stay the night in the hospital to get that restriction back and help them lose weight. So we have a lot of options, and we're always here for our patients, and even patients that have been in other practices that are struggling and need help, we're here for them too.